Hi, my name is Melissa Corbin. I'm in the Family Nurse Practitioner program at Eastern Kentucky University. The healthcare problem that I've chosen to review is hypertension. Hypertension, if left untreated, can lead to heart attacks and strokes. The American Heart Association recommends the dietary approaches to stop hypertension, or the DASH diet plan. The diet is low in sodium, red meat, sweets, and fats, and has been shown to lower blood pressure in certain individuals. Clinical guidelines from the American College of Cardiology also recommends the DASH diet. They recommend it for a non-pharmacological approach to control hypertension. According to the guideline, the non-pharmacological intervention strategies, such as the DASH diet, are effective in adults with hypertension as a means of control, especially in milder forms. The purpose of the Dash Away from Hypertension project is to promote and encourage healthy eating habits as a non-pharmacological intervention for lowering blood pressure. This can be done by teaching the DASH diet program to volunteers with hypertension. Education and frequent encouragement will be provided to promote compliance. The target population for the evidence-based practice change is MedCenter health employees that have hypertension. All MedCenter health employees are over the age of 18. Decreasing blood pressure in individuals with hypertension can help improve their overall health status. Pharmacological interventions are not the only way to control hypertension. Blood pressure can be controlled by following a healthy diet. Advanced practice nurses have the opportunity to promote health and wellness through teaching and building relationships. Teaching patients that the food they put in their bodies can change their health status, and working together to implement a diet could improve health without medications. 3 randomized control studies and 1 randomized crossover study were chosen from the literature review. The 4 studies that were chosen were completed within the last 5 years. 3 of the studies had intervention groups and control groups. The intervention groups all received dietary counseling, and the control groups received standard care. The crossover study chose diets at random. All of the studies did include patients that had hypertension, and all of the studies had outcomes that favored using to lower blood pressure. For the Dash Away from Hypertension project, registered nurses will be recruited to volunteer as team members through the Clinical Ladder program. Working on an evidence-based practice change will count towards earning Clinical Ladder recognition. Clinical Ladder recognition includes a banquet, a plaque, and monetary incentives. Utilizing these registered nurses will save money because they volunteer to work on these projects on their own time. Participant volunteers will be recruited from MedCenter Health through email and posters. All of the volunteer participants will sign consents, and measures will be in place to protect their privacy. One-on-one teaching of the DASH diet will be taught by an RN with follow-up phone calls weekly for encouragement to answer questions or concerns regarding the diet. Participants will also be instructed to keep a log of their dietary intake throughout the project. Blood pressure will be measured at baseline, weekly for 1 month, bi-weekly for 1 month, and monthly for 10 months, as well as at the end of the project. Blood pressure will be measured with a Welch Allyn electronic cuff after the participant has been sitting in a chair for 5 minutes. MedCenter Health Employee Health Department will be utilized for one-to-one teaching as well as the blood pressure measurements. Blood pressure readings will be communicated to the participants at each meeting. Blood pressure Readings will be compared using T-scores to determine if following the DASH diet improved blood pressure for the participants. The outcome data will be analyzed and presented at the annual Evidence-Based Project Poster Board presentation at MedCenter Health. The DASH diet has been shown to improve blood pressures and is recommended by the American Heart Association as well as the American College of Cardiology. Implementing an evidence-based practice change, such as incorporating a diet change that could improve overall health, would be beneficial to the participants as well as their families and coworkers.